Hello everyone. We thank you for your interest in our presentation, which is entitled KAP Survey on Occupational Safety and Sustainability of Radiology Practice in DR Congo, presented by Serge Boika, resident at Department of Radiology, University of Kinshasa, Faculty of Medicine. Background 1. Radiology play a pivotal role in healthcare for diagnostic and therapeutic purposes. However, medical imaging is often associated with occupational safety and health issues, including ionizing radiation that may cause cancer, skin disorders, tissue damage, sometimes death. Studies show that radiology professionals face physical strain and chronic fatigue. Also, sleep-related issues due to shift work, lighting, noise, and vibrations. Background 2. The digital technology, including equipment used to provide healthcare services, X-ray, ultrasound machine, etc., shares 4% of the global greenhouse gas emissions, CO2 emissions. And according to a recent French report, one MRI device consumes the total energy of about 700 homes. And the digital technology uses over half of the total energy, particularly in terminals, in data centers, and in different networks, such as those used in hospitals. Background 3. Then, what is sustainability in medical imaging? It is about the rational use of resources in Department of Radiology or radiology services in hospitals, and the respect of technical, legal, and environmental standards. In case of non-compliance with standards and safety guidelines that have been established by experts in the field of radiology, that can lead to adverse health effects in humans and also cause negative impact in the environment. Thus, what is eco-responsibility? According to Digital Health Agency recommendation in the United European Union or France, before using a digital service or equipment, we need to prioritize services to be deployed according to expected benefits. We need to promote eco-design approaches when purchasing new equipment in radiology services and avoid the accumulation of digital waste that will consume a lot of energy. So during the life of an equipment, we need to maintain it to ensure sustainability, and we also need to favor the reuse of equipment and promote recycling of the equipment. And we also need a good management of non-recyclable waste. So the objective of this study was to assess the knowledge of radiology specialists, doctors, and radiology technicians regarding sustainability and safety of radio imaging. Let's summarize the method. So this was a descriptive cross-sectional study conducted in 5 referral hospitals in DR Congo with a sample size of 178 radiology professionals, including 159 specialist radiologists, doctors. And the survey used self-administered anonymous questionnaire online, and it included questions on social demographics, sustainability in radiology, eco-responsibility in radiology, and collected survey data were transcribed into an Excel file before analysis. ethical matters were cleared. So let's summarize the main result of our survey. Number one, the social demographic and occupational characteristics of the study participants. So the majority were younger, 76.9% of them were aged less than 40 years, and most of them were male, 61.2%. And regarding occupation, a large majority were radiology specialists, doctors, 89%. Main results too, regarding accurate knowledge on sustainability of radio imaging, only 13% had accurate knowledge on sustainability in radiology, whereas about 88% did not have knowledge on this concept. Regarding the source of information regarding sustainability in radio imaging, 16.3% of the participants who had knowledge received this information from the media. Main result 3, about accurate knowledge on most important indicators of sustainability in radiology, only 51%, so half of the participants, had knowledge regarding emission of ionizing radiation as the most important indicator of sustainability in radiology. And for a co-responsibility in radiology, this concept was known by only a few participants. The large majority, 74%, ignored this concept. In summary, this is the first pilot study that assessed the knowledge and practices of Congolese radiology professionals on safety and sustainability of radio imaging. And it was observed that the large majority, almost 88% of the participants, lacked knowledge on safety and sustainability associated with radiology, and only half of the participants knew that ionizing radiation is an indicator of sustainability, and eco-responsibility in radiology was ignored, unknown for most of the participants, and we didn't observe any difference in terms of knowledge on eco-responsibility and sustainability in radiology practice among technologists and doctors. As a recommendation, there is a need for education, for capacity building on work safety and sustainability in radiology for Congolese radiology professionals. Thank you very much for your attention.